To start off, would you please tell us your job title and where you work?
Sure. I'm a staff psychologist at the VA Northern California in Martinez, and I'm an associate professor at Palo Alto University in Palo Alto, California.
What were the reasons you decided to pursue clinical psychology, opposed to the other specialties in psychology?
Well, I was always interested in how people's thoughts and behavior made their life productive, or how it sometimes got in the way. And it seemed like clinical psychology was the best way to help people improve their lives using different psychological principles and techniques to make them have better mood and have better relationships and be happier with their life.
Was there anyone who influenced your career choice?
Yeah, I was taking classes when I was undergraduate at UC Davis, and I had two different professors who I really liked. One was a guy named Dr. Emmons, who taught us about the different problems that people could have, like depression or anxiety or post-traumatic stress. And then another doctor named Dr. Horn, she taught us the different ways to help people. And these were classes that made me think, man, that would be really interesting to do as a career. And so they both really were two of the people that shaped my desire to become a clinical psychologist.
What were all the steps you went through to become a clinical psychologist?
Well, there's a lot of school. So I went to undergraduate at UC Davis, and then I did a graduate program in clinical psychology at University of Kentucky, where I got my master's degree and my PhD. And then I did an internship at the Palo Alto VA, and I actually did a postdoctoral fellowship after that at Stanford. And during all of those times, I was taking classes, I was doing research, and then I was also learning how and actually counseling people who had different kinds of difficulties.
How long did the entire process take?
Well, it took a total of 8 years from after my undergraduate, so a total of 12 years after high school.
At any point in becoming a clinical psychologist, did you want to give up, or were you always determined to meet your goal? If so, what kept you determined?
I don't think I ever thought of giving up, but it was a long process, and the things that kept me determined were enjoying working with people and learning. I really like school and I like learning, and so over time I felt like I was learning more and more, even though it took a long time. And I also saw that what I was doing was helping people and making their lives better, and so that was inspiring and kind of helped me keep doing the hard work to get it done.
Now, can you walk us through your workday?
Sure. Each day I kind of do a mix of things. So some of the time I am doing counseling with patients. So people come to my office and I meet with them to help them either talk about their mood or their emotional struggles, or help them manage their physical problems like chronic pain, or help them lose weight, or different things that they're trying to do to improve their health. I also supervise people who are training to become psychologists, so I meet with them and help them know how to best help their patients. I also teach classes, and I also do research. So I am working to try and understand how people adjust to trauma. So each day I'm kind of doing a mix of all of those things.
What is your favorite part about being a clinical psychologist, and what are some difficulties that come with being a clinical psychologist, specifically for veterans?
My favorite part of being a clinical psychologist is seeing people work hard and improve their lives. So it's inspiring to see people who are doing brave things and trying to change how they approach their life and then reap the benefits by feeling better. Some of the challenges are working with people who are kind of hopeless at times, or who maybe are feeling very angry and misunderstood by other people. And so that sometimes can be hard. And veterans very often are dealing with a lot of challenges because of the work that they've done in the military. And so that can be challenging, but it's also very inspiring because these are people who have essentially put their lives on the line for our well-being. And so even though it can be challenging, it's also very rewarding, and they deserve the help.
Which personality type do you think will be most fit for this career?
I think that to be a clinical psychologist, you have to enjoy working with people. So some of us like to just stay on our own and hole up and just be on a computer or something. And to be a clinical psychologist, you really have to enjoy interacting with other people. You also have to be a critical thinker. So you have to kind of think about things from different perspectives and think about different solutions to problems. And then you also have to be very flexible. So if one solution doesn't work, you have to be flexible and try another. And so I would say those three things: being a critical thinker, being flexible, and then liking interacting with people.
Which methods of clinical psychology do you practice?
I guess the two main methods of clinical psychology as far as counseling goes are cognitive behavioral therapy and something called acceptance and commitment therapy. Cognitive behavioral therapy is about helping people notice their thinking and their thoughts and how that might contribute to their mood or their anxiety problem. Acceptance and commitment therapy is about helping people notice what they value most in life and helping them do that, even though sometimes they might feel depressed or anxious or have an uncomfortable feeling that they would have to carry with them while they do the things that are important to them.
And why did you choose these methods?
Both of them have a lot of research to support them, meaning that scientists or psychologists who study different ways of counseling have found that that these methods are stronger, better ways to help people, and so they are based on science. And so I think that's a good way to improve people's lives, is to do things that are proven to work.
Can you share something that many people do not know or would find surprising about your career?
I can share two things. One is that there is a lot of paperwork or typing. So you end up having to write a lot of reports and do a lot of computer work in between your meetings. I think another thing that's surprising is a lot of people think, oh man, that must be really depressing or really stressful or sad to talk to people about their problems every day. And it turns out that it's actually pretty inspiring and gives you a lot of energy, especially if you're one of those personality types that I talked about that likes interacting with people.
How has clinical psychology changed since you began your career? And what future changes do you think are in store?
It's changed over the past 20 years, which is about how long I've done this, because it's become more science-based. There's more and more pressure to use counseling strategies that have evidence that they're useful and effective. So that's one way it's changed. And the way it's changing is that instead of worrying so much about what kind of counseling and what kind of problem a person has, like depression or anxiety or post-traumatic stress, clinical psychology is more and more focused on what are the mechanisms that lead to a problem, like extreme negative thinking or avoiding situations or not being able to tolerate strong emotions. And so rather than trying to match treatment approaches to a diagnosis like depression or post-traumatic stress, we're more and more focused on trying to treat the different mechanisms that cause problems.
Thank you so much for telling us about your career as a clinical psychologist.
Thanks for having me. It was great.